Okay, Bismillahirrahmanirrahim. Assalamu alaikum everyone. I hope you all are fine and doing well. These are the few important lower limb Viva related questions which I am going to discuss with you today. This is a part 1. Name the bones forming the hip joint. You must know the bones of which are forming the hip joint, which is the head of the femur and acetabulum of the hip bone. What is the chief extensor of the hip joint? It is gluteus maximus, and the function of it is usually asked. Okay, you must know the function of the gluteus maximus, and it is supplied by the which nerve supply the gluteus medius. Gluteus medius is supplied by the superior gluteal nerve, and which nerve is injured in the deep foot drop, common peroneal nerve or fibular nerve. A picture can be given to you in the exam that may be shown to you, like a foot drop is given, a picture is given to you in which a foot drop is shown. So a question can be asked to you that which nerve is damaged. So you are going to write down common peroneal nerve, which nerve is felt behind the medial malleolus. Tibialis posterior tendon is felt at the medial malleolus. What are the boundaries of the femoral triangle? It is a very important question that can be asked to you in the Viva question as well, in the SAQ as well. Superior boundary by inguinal ligament, lateral by sartorius, and medial by adductor longus. What are the contents of the femoral sheath? Femoral artery, vein and nerve. Femoral artery, vein and canal, lymphatics. Okay. Which nerve passes through the adductor canal? Saphenous nerve passes through the adductor canal. It is also an important question. Which artery is felt behind the knee in the popliteal fossa? Popliteal artery is felt. Okay. Name the boundaries of the popliteal fossa. And okay, one more thing, please keep this thing in mind, that the pulsation of the artery is felt, not the nerve. Please keep this thing in your mind. Okay, do not get confused. Nerve is not palpated, artery is palpated. Please do not make such kind of blunders in the exam. Name the boundaries of the popliteal fossa. Superolateral boundaries formed by the biceps femoris, superomedial by semitendinosus and semimembranosus. Inferolateral or medial boundaries formed by the gastrocnemius head. Which muscle forms the hamstrings muscles? 3 muscles form the hamstrings muscles: biceps femoris, semitendinosus and semimembranosus. What is the Taylor's muscle? Sartorius. And you must also know why it is called Taylor's muscle. Okay. Which bone fracture leads to avascular necrosis of the femoral head? In the upper limb it was scaphoid, and in the lower limb it is fracture of the neck of the femur. Which ligament is tested in anterior drawer test of the knee? Anterior cruciate ligament is tested in anterior drawer test of the knee. Which arch of the foot is maintained by tibialis posterior? Medial longitudinal arch is maintained by tibialis posterior. Which nerve supplies the sole of the foot? Medial and lateral plantar nerves or branches of the tibial nerve. Which vein is usually used in the coronary bypass graft? Great saphenous vein is used in the coronary bypass graft, that you must all know. What is Trendelenburg gait and its cause? It's basically the drooping of the pelvis on the unsupported side due to the damage to the superior gluteal nerve, and it is a V due to the injury. And superior gluteal nerve supplies which muscles? Gluteus medius and minimus. So there is weakening or the wasting of the gluteus medius and minimus muscle. Which nerve injury causes loss of the patellar reflex? Femoral nerve. L2 and L4 causes patellar reflex. Knee jerk question can be asked to you in the Viva question as well, that how the knee jerk is performed, why it is performed, and if there is injury, what it leads to. These kind of clinical related question can be asked to you in the exam as well. Okay, do prepare for that. Which muscles form the calf muscles or triceps suri muscle? It is the triceps suri is basically the tri means 3. Tri means triceps suri names indicate there are 2 heads of the gastrocnemius, which I have already told you in my previous model of the thigh and the limb video. You need to see that video to see the medial head and the lateral head of the gastrocnemius and the soleus muscle. That is why it is known as triceps suri muscle. And an Achilles tendon is also present in it. Okay, you must confirm this thing as well. Okay, what type of joint is a knee joint? It is the modified hinge type of synovial joint. Name the bones forming the knee joint: femur, tibia and patella. What structures form the articular? Which structure? What structures? Which structures form the articular surfaces medial and lateral condyle of the femur and tibia and posterior surface of the patella. ये आपकी नी जॉइंट की सारी स्ट्रक्चर है जो आर्टिकुलेटिंग सरफेस आपकी आ रही हैं. यू कैन सी इट इन द रेडियोलॉजी वीडियो एज वेल, in which I have shown you that what structure deepen the tibial articular surfaces, medial and lateral menisci. Questions related to menisci can be asked. What is the importance of the menisci and which menisci are present? Name the intercapsular ligament of the knee joint, anterior cruciate ligament and posterior cruciate ligament. Which ligament prevents anterior displacement of tibia on femur? Anterior cruciate ligament. And which ligament prevents posterior displacement of tibia on femur? This is the posterior cruciate ligament. It is a very, very important question that is asked to you in the Viva question, and please do not get confused. Anterior displacement of tibia on femur is prevented by the anterior cruciate ligament, and posterior displacement of tibia on femur. Please, if the question is asked to you and vice versa, the answer will be different. Okay. What is the function of the menisci? Menisci function is shock absorption, increase congruence of the articular surfaces. Which menisci is more commonly injured? Medial meniscus is more commonly injured because it is less mobile and it is attached to the medial collateral ligament. What is the blood supply of the knee joint? Genicular branches of the popliteal artery. What is the nerve supply of the knee joint? Femoral, tibial, common peroneal nerves. Hilton's law. Now you must know about the Hilton's law. What is the Hilton's law? Okay, Hilton's law is important from the anatomy and surgery point of view. The nerve that supply a joint, and also it supply the muscle that move the joint and the skin over the insertion of those muscle. If the nerve innervates a muscle crossing a joint, it also gives branches to the joint capsule. So the same nerve also sends sensitive fibers to the skin covering the muscle insertion area. Which condition involves the dislocation of patella? Mostly lateral dislocation of patella. What is the popliteal fossa? Diamond shaped depression behind the knee joint. It is very important from the OSPE point of view as well. What forms the superior-lateral boundary? Bicep femoris. What forms the superior-medial boundary? Semitendinosus and semimembranosus. What forms the inferior-lateral and inferior-medial boundaries? Lateral and medial heads of the gastrocnemius form the inferior-lateral and the inferior-medial boundaries. Okay, you must know the boundary of the popliteal fossa. What forms the floor of the popliteal fossa? Popliteal surface of the femur, capsule of the knee joint and popliteus muscle obviously. What forms the roof of the popliteal fossa? Skin and deep fascia with a small saphenous vein and cutaneous nerve. What are the contents of the popliteal fossa? It is vein, that is popliteal artery, popliteal vein and tibial nerve, not the popliteal nerve. Please do not make such kind of mistakes in the exam. Which artery is palpated in the popliteal fossa? Obviously popliteal artery, but it can be given to you in the OSPE, but use your common sense. Sometimes it is not given due to the exposure part. This part cannot be exposed on the subject. Okay, now what is the subject? Subject is a person on which you are going to perform the interactive session, or the artery, or can mark the surface anatomy on that person. Subject means person. Okay. Which veins are found in the popliteal fossa? Popliteal vein. Termination of the basically it is termination of the small saphenous vein is terminate into the popliteal vein. Which nerve passes through the popliteal fossa? Tibial nerve, common peroneal nerve, genicular branches. The same answer. What is the clinical importance of popliteal artery? It is a common site of the aneurysm. It compresses the tibial nerve. Hamstring muscles are the group of muscles that are present at the back of the thigh that crosses both the hip and the knee joints. Muscle include bicep femoris, semitendinosus, semimembranosus. Sometimes ischial head of the adductor magnus is also considered the pass of the hamstrings muscle. It is very important. You must know about it. Okay, so few examiners are also asked about the origin. Its origin is these muscles basically originate from the ischial tuberosity. You can see it in the radiology video that where is ischial tuberosity present, except a short head of the bicep femoris and inserted onto the bones of the leg and tibia and fibula. It extends the hip and flexes the knee. It is supplied by the tibial part of the sciatic nerve, except a short head of the bicep femoris, which is supplied by the common peroneal nerve. Hamstrings are the same thing. Hamstrings are the compartment. Hamstrings are the posterior thigh muscles. Bicep femoris, long head, semitendinosus, semimembranosus, adductor magnus ischial part arising from the ischial tuberosity supplied by which nerve? sciatic nerve. If the sciatic nerve is is damaged or injury of it, so hamstring muscles are going to damage. You must know the name of the hamstring muscles, and there will be a person is going to there will be a difficulty in performing extension of the hip and flexing the knee. In the flexion of the knee, a person is not going to perform the extension of the hip and flexion of the knee. What is these things can be asked to you vice versa. Okay, you must learn all these things. What is the obturator foramen? Obturator foramen, it can be given to you on the x-ray as well. It can be marked to you and the contents can be asked to you. What is obturator foramen? It is formed by the pubis and ischium, closed by the obturator membrane except at the obturator canal. Contents are obturator nerve, artery and vein. Greater sciatic foramen is very important for the osteology point of view, that it is formed by the greater sciatic notch, and it is formed by the which ligament? Sacrospinous ligament, sacrotuberous ligament, and divided by which muscle? Piriformis muscle, divided into suprapiriform and infrapiriform compartments. The contents are above is present suprapiriform, piriformis, which is supplied by the superior gluteal nerve, artery and vein. Below piriformis, infrapiriform is present. Sorry, I made a mistake over here. Piriformis is not supplied by the superior gluteal nerve, artery or vein. It is basically the content. Above it, superior gluteal nerve, artery and vein present, and below piriformis, these are the contents which are present, that includes inferior gluteal artery, nerve and vein, sciatic nerve, posterior femoral, cutaneous nerve, pudendal nerve, internal pudendal artery and vein, nerve to obturator internus, nerve to quadratus femoris. Okay, similar is that for sciatic foramen. You must know, it can be asked to you in the osteology point of view. It is very important. Okay, it is formed by the lesser sciatic notch, by sacrospinous ligament and sacrotuberous ligament. Now you can see here, it was the sacrospinous ligament and sacrotuberous ligament, both are forming, sacrospinous and sacrotuberous ligament, but the difference is formed by the greater, it is formed by the greater sciatic notch, it is formed by the lesser sciatic notch. The contents of the lesser sciatic foramen are tendon of the obturator internus muscle, pudendal nerve, internal pudendal artery and vein, and nerve to obturator internus. Okay, if the greater sciatic foramen is given to you, you can write down the contents of the either you can write down any of the content, like superior gluteal nerve. Use your common sense. Okay, use always smartness in your in the exam. So if you do not know the answer, you can at least write down superior gluteal artery 1, superior gluteal 2, superior gluteal nerve 3, superior gluteal vein. Okay, so you will in this way you can get 3 marks. If you do not know these things, at least you are going to get good marks in the OSPI. Use your common sense, please. Obturator foramen contains obturator nerve and vessels. Greater sciatic foramen contains gluteal vessels, nerves, and sciatic nerve, pudendal nerve and vessels. Femoral cutaneous nerve, nerve to obturator internus and quadratus femoris. Lesser sciatic foramen contains pudendal nerve and vessels, obturator internus, tendon, nerve to obturator internus. What type of joint is the hip joint? Ball and socket type of joint. Which bone forms the hip joint? Which we have already discussed. Head of femur and acetabulum of the hip bone.